think about Anthony's last point of information versus promotion and as being a regulatory issue, our perspective is it's far more than that. Information versus promotion, that guiding principle is there for best practice and ethics, but it's also there to help us understand how we should interact in the social media space. So the tipping points that Anthony's discussed have really detailed that people, the way they interact with the media, the way they interact with social media has changed. They want to be talked to, not talked at. They want to share information. They don't want to have ideas pushed upon them. And basically, we've seen a shift from deference to reference. So people do not want to defer to authority. They want to refer and have dialogue. So information versus promotion is actually a key tenet that any healthcare institution should consider in its social media planning. And it's something really we take forward into our approach to social media. So, as mentioned at the start by John, the network partner agencies across the globe have all undertaken lots of social media activities locally, and what we've done is pulled that information and that best practice to come up with international guidelines, international principles for planning social media campaigns. And coming back to this point of deference, not reference, and the changing conversation, the key thing that sits in the middle of that is a patient-centric approach, and a patient-centric approach that really looks for unmet needs and where a healthcare institution, whether it be a pharmaceutical industry, a charity, or a patient group, can add value to those individual people who are seeking ways to improve their health outcomes via information and via dialogue. So, distilling all of that down into principles that guide our thinking, we have four key principles. The first is understanding, and that social media, you cannot jump into it without first listening to the environment. So, as we move through the presentation today, we're going to talk you through our listening methodology, and we call it smart listening. Listening isn't about sucking in quantitative data and looking for a trend. It's about digging into the data and understand the meaning, the emotion, the insights behind why people behave about their health in the way they do. And with understanding, we really believe patients should be part of the journey. They should be involved with planning social media from the outset, so that everything that's being developed is responding to their needs rather than being pushed out to them. And you have to add lots of value. So it's a busy world out there. People are bombarded on the internet from every single direction. Think about apps you use on your phone. Apps only work for one of two reasons. It's funny, and you might use it temporarily, and then you get bored of it, or it has utility. So the kind of banking apps that Anthony talked about. When we're looking at health, that's what we have to find, the value we can add, and we have to be generous with it. The social media community expects organisations to continue to give and build and have a relationship. So you can't look for a one-off solution which you pump out and assume that that does the job. What we find with social media is communities develop around thought leaders, and those thought leaders can be individuals or institutions, but what all of those thought leaders have is unique content, unique perspective that they can bring to dialogue, to a conversation. And when we look at healthcare, we believe, the pharmaceutical industry should be proud of the information, the research, the development, and the scientific insights that it has, which it could share with the community. As we go through the malaria data, you'll see that those scientific insights are interesting in the social media space. So institutions such as pharma, or such as patient groups and public health bodies, should be proud to share that information and to do it frequently. And then our final principle is to be open-minded. 2-3 years ago, to develop a website would cost you 100k, because it would have to be a bespoke construction of complicated programming. Right now, because of the diagram Anthony showed with the two axes, the development community is rife, and there's lots and lots of amazing software being developed cheaply that can be utilised to empower social media. So, bearing in mind all of those principles, all of those best practice learnings that we've gathered globally, we've formalised our insights into a framework for managing social media, a framework which puts patient insights and understanding at the centre in an ongoing fashion, so always listening, but really looking for that one valuable idea, that one place where you can connect with the community and have something that resonates with them. And this is our social framework. So this is a methodology, a global methodology for pulling in insights from across the world of healthcare social media specialists using both quantitative and qualitative methodology to find the areas of overlap I've discussed, and then to look at how those areas overlap are turned into something which we call a personal engaging proposition, or in other words, a reason that a social media user would want to engage with you. What do you have to say that's valuable and will resonate? Now, it's a complicated process, but it's simplified down into this diagram, which is a continuous feedback loop of smart listening and refining the engaging proposition. So social media is live and it changes constantly. You constantly have to listen and you constantly have to check that you're adding value. But from a strategic perspective, you need to be absolutely crystal clear what is that piece of value that you bring to the table. So, as John mentioned at the start of the presentation, malaria, the figures are shocking, they're also compelling. And why today do we find ourselves with these kind of figures globally? Why is a child dying every 45 seconds from a disease which is preventable? We reflected upon those figures and we thought, can our methodology be applied to the social media space? Of course, we can't change a pandemic disease, but what we can do is change behaviours, change opinions, and leverage actions towards controlling this disease. So, thinking about our methodology, thinking about patients first, the very first thing we did was speak to people around the globe to understand what malaria meant to them. And I just want to share a short 2-minute case study with you from the UK to give some framework to malaria considerations.
Hi, I'm Nathan and I've been living in Sierra Leone in West Africa for about a year and a half, working for an NGO based in the capital city, Freetown. After a year or so of being in Sierra Leone, I contracted malaria. At first I thought it was just a cold or flu, I felt a bit under the weather. Then I realised after a few days the symptoms didn't clear up. I went to go and see a doctor and had a test and it was confirmed that I'd contracted malaria. Luckily for me, I was able to afford the drugs that I needed, and within a few weeks I'd made a full recovery. Nonetheless, it was pretty unpleasant. I was in bed for several weeks, tired, headachy, unable really to get out of bed, and even after I was sort of better, I still felt tired, was unable to do lots of the things that I normally take for granted, like playing sports or going out with my friends. The other thing that struck me from my experience was just how lucky I was that I was able to afford the drugs that I needed to make a full recovery. Malaria is potentially life-threatening, certainly if you don't have the treatment that you need. And for many of the people who I work with, it's a real danger. Because it's something they're exposed to all the time, it comes to be seen as something like a common cold or flu. It's something that you know you're going to get at some point, so why do anything about it? But it's really serious, and especially so for pregnant women or young children. Millions of people die around the world from malaria every year, and it's not perhaps recognised as serious as it is. When you go to one of these countries in a malarial area, in a tropical area, you might be made aware that you need a yellow fever certificate, for example, because you need it to get into the country. But if you didn't go to your GP or a specialised travel clinic, you would have no way of knowing that you really should take malarial precautions as well. Not just taking the drugs, but making sure you have a bed net and making sure you take enough spray so that you can use it in the evening. And unless you take these precautions, you're really exposing yourself to a serious risk of a very nasty illness and potentially something even worse, something which people who live there deal with every day of their lives.
So, from speaking to people like Nathan, from doing some initial toe dipping into social media to get a flavour of what was going on with regards to malaria, we were able to develop some hypotheses that we then wanted to test more broadly. And for me personally, some of the things that really came through from Nathan there were the lack of guidance on information, so the yellow fever analogy. I travel to India frequently. I wasn't aware of the need for prophylaxis, and I wouldn't necessarily have been aware even to take treatments if I hadn't been nagged by family members. There was no institution leading that knowledge for me, and I didn't subsequently stumble across information in the social media space. So these kind of points resonated to us all. So we set out to test the following 4 points. So firstly, malaria prophylaxis does not tend to be discussed in the social media space. Conversations focus on managing acquired symptoms. The second point was that insights and understanding of malaria don't tend to be shared between countries, so closed local conversations. The third one was that we assumed there would be a lack of leadership here by healthcare institutions just based on these initial toe-dipping insights. But what we did think was, because there is that lack of influence from institutions, with World Malaria Day, it might have a very big impact in social media, and what we might see is a long tail. So the concept of a long tail is, if you think of traditional media, a story will spike on a day, it may remain for a day or two afterwards, and then it's gone. What we typically see with social media is a long progressive curve, and that curve is for 2 reasons. One, if you're a person who reads a lot of blogs, there might be 500 new posts in your reader per day, so in your lunch break you might read 10 of them. So it takes a while to stumble onto content, hence a longer tail. The more important reason though is with social media with good content, people will then write their own blog post, they'll share it, so it causes continued spikes, continued lift in messaging. So that's a long tail, and we wanted to test whether World Malaria Day would cause that for social media. So to test those hypotheses, we needed to have a rigorous methodology. We needed to take a baseline prior to World Malaria Day to understand what the general patterns were in social media, and then we needed to have the active control to see the impact of World Malaria Day. So if we look at the graph, the red dots are baseline markets, so 5 markets representing each kind of major continental area undertook 3 weeks of monitoring. So that was in the US, in Mexico, in Portugal, Spain, in India and in the UK, and then we had, sorry, that was 6, and then we had additional for the World Malaria Day to just check the impact on a wider scale. We were joined by partner agencies in Poland, Turkey, Germany, Argentina and Chile. Now what did we monitor? Anthony talked earlier about forums being a very rich area for social media. We actually did not monitor forums, because what we're looking at here is a pandemic disease. This is a disease which needs to be discussed on a mass scale. A forum is a very niche community with strong opinion leaders, but they are typically confined within their space. So we excluded forums. Part of that also is we believe that smart social media listening can be a modern day international focus group in effect, and it can be cost effective, very cost effective, but to do that you have to limit the parameters of your listening activity. The second point to consider is Facebook. So we talk about maximising efforts. Now Facebook, just due to the way it's structured and privacy settings, you can get a certain amount of insight from Facebook, but you are only getting a small piece of the pie. So to focus your analysis on Facebook could very much skew your results. So we excluded Facebook from the analysis. And we used a mix of automated and manual tools to do this. And the reason for this is, again, talking about social media listening being a cost-effective approach to get some really deep insights. You don't always have to pay to use proprietary software. So in a number of the markets we use Google tools, we use Hootsuite with geotagging, we use other free software to structure our listening. In the States though, it's a slightly different story, so I'm just going to flick back to Anthony to run through that.
Hi, it's me again. As Aaron said, in the States, it's a slightly different story. The sheer volume of information that we have to sort of troll through makes it inhibitive to use sort of these free software tools. What we typically find is that the man hours used to expel resources to pull in all that information through free tools doesn't really, it isn't worth it to do that if you look at the cost of some of the higher end tools.